Many diabetic patients are not sure about what the relationship between diabetes and infertility is. And a lot of doctors will spend a long time getting their blood sugar levels and the HbA1c back to normal before they start an IVF treatment. Now, there are two things you need to understand. High blood sugar levels or diabetes by itself will not affect your fertility. I know that sounds a little counterintuitive, but that's the truth because you will continue to ovulate. It will not affect the sperm count in the man either. So, you also need to remember that high blood sugar levels do not increase the risk of miscarriages either. Now, again, this is not something which most doctors or patients know, but that is the reality. So why do we want the HbA1c level back to normal? Why do we want the diabetes to be well controlled before the patient gets pregnant? The answer is common sense, because if you have a well controlled blood sugar level, the pregnancy is likely to be much more uncomplicated, much more uneventful, and ultimately, don't forget, that's the goal. Not just to get the patient pregnant, but to give her a healthy baby. And obviously, if you make a diagnosis before starting the IVF cycle, it makes sense to optimize the blood sugar level and the HbA1c before you actually put an embryo back. A lot of this is common sense, but you also need to remember that you cannot afford to waste too much time, especially in the older diabetic woman, on trying to optimize what her levels are. And for a lot of these women, the best thing is to put them on insulin levels, get their blood sugar levels back to normal as quickly as possible so that they can get pregnant and go on to have a healthy, uncomplicated pregnancy.